According to the Centers for Disease Control and Prevention, 3 million seniors are treated in emergency departments for fall-related injuries every year, and 1 out of every 5 falls causes a serious injury, such as a broken bone or a head trauma. Most of these individuals were active, and many walked every single day, yet their bodies still failed them at a critical moment. If you believe that your daily walk is a sufficient shield against this physical decline, you are operating under a dangerous misconception that ignores the fundamental biology of aging. Walking is excellent for your heart and lungs, but it is not a strength-building activity, and as we age, it is the loss of raw power, not just endurance, that leads to the loss of independence. There is a silent crisis of muscle wasting that walking simply cannot stop, and understanding why could be the difference between staying in your home or moving into assisted care. Today, I am going to introduce you to 3 specific, clinical movements that target the vital muscle groups your daily walk completely ignores. Movements that every surgeon and mobility researcher knows are the true keys to staying upright and capable. Before we explore the clinical movements that can actually protect you, I want to invite you to participate in our community. Please leave a comment below telling us which city and country you are watching from today. I personally read through these comments to understand who we are reaching, and if this information is valuable to you, please like the video, share it with a friend, and subscribe to join our mission of healthier aging. As a physician who has dedicated years to understanding the musculoskeletal health of older adults, I must explain the biological reality of why walking is failing to protect our seniors. After the age of 65, our bodies undergo a rapid acceleration of sarcopenia, which is the involuntary loss of skeletal muscle mass. However, the loss is not uniform across all muscle types. We have slow-twitch fibers designed for endurance and fast-twitch fibers designed for power and balance. Walking is almost exclusively an endurance activity. It maintains your heart and your slow-twitch fibers, but it leaves your fast-twitch fibers, the ones that prevent you from falling when you trip, to atrophy into non-existence. This is why I see patients who can walk 3 miles a day but cannot stand up from a low sofa without using their arms. Their cardiovascular engine is fine, but their structural frame is collapsing. To combat this, the first clinical movement we must focus on is one that surgeons use as a primary diagnostic tool for functional age. It is a movement that recreates the most basic requirement of independence, moving your center of gravity from a seated to a standing position. In the clinic, we call this the chair sit-to-stand, and we specifically use the 30-second chair stand test to determine a patient's statistical likelihood of maintaining long-term independence. This movement is a compound exercise, meaning it requires multiple joints and the largest muscle groups in the human body to work in perfect synchronicity. When you perform a sit-to-stand, you are forcing the recruitment of the gluteus maximus, the quadriceps, and the deep stabilizers of the pelvic floor and core. These muscles act as the foundational scaffolding for your entire torso. To perform this safely, you must find a sturdy, armless chair and place your feet shoulder-width apart. The mechanics are precise and medically significant. You must lean your upper body forward slightly to align your center of gravity over your midfoot, then drive with conviction through your heels to a full upright position. You should strive to avoid using your hands entirely, as relying on your arms is a clinical indicator that your lower body strength has fallen below the safety threshold required for independent living. The downward phase of this movement is actually where the most significant medical benefit occurs. As you lower yourself slowly back to the seat, you are performing what we call an eccentric contraction. This type of controlled tension is the most effective way to strengthen the tendons and ligaments surrounding the knee joint, creating a natural protective sleeve that prevents joint instability. By performing 8 to 12 controlled repetitions for 2 sets, you are sending a potent neuromuscular signal that walking alone never provides. You are essentially telling your brain that it must maintain the power to move your body weight against the constant force of gravity, which is the baseline requirement for navigating your own home safely. Within just a few weeks of consistent practice, the neural pathways between your brain and these large muscle groups become more efficient, making every daily movement feel noticeably lighter and more secure. While the strength of the thighs and hips provides the power for vertical movement, we must address the foundation of your entire kinetic chain, which is the lower leg and ankle complex. In medical circles, The calf muscles, specifically the gastrocnemius and the soleus, are frequently referred to as the second heart. This is because their rhythmic contractions are essential for pumping venous blood from the lower extremities back up toward the heart against the relentless pull of gravity. When these muscles weaken, which they do more rapidly than almost any other group after age 65, you experience a double failure. Your circulation becomes sluggish, leading to swelling and fatigue, and your balance becomes dangerously compromised. The calf muscles are responsible for the fine-tuned, millisecond adjustments that keep you upright on uneven surfaces like grass, gravel, or thick carpeting. Walking only utilizes about 20% of your calf capacity because the mechanical load of a standard step is incredibly low. To build the kind of structural integrity that prevents a fall on a slippery rug or a sidewalk crack, we must utilize a second clinical movement, the controlled heel raise. This exercise isolates the ankle stabilizers and strengthens the Achilles tendon, which serves as the primary shock absorber for your entire body. To perform this safely, stand near a wall or a heavy counter for balance. Rise onto the balls of your feet as high as you comfortably can. Hold the peak tension for 1 full second to ensure maximum muscle fiber recruitment, and then lower your heels back to the floor with deliberate slowness. This movement improves what we call proprioception, which is the neurological feedback loop that tells your brain exactly where your feet are in space without you having to look at them. After age 65, this sense often dulls, leading to a loss of spatial awareness and a resulting increase in stumbles. By forcing the calves to carry 100% of your body weight through 12 to 15 repetitions for 3 sets, you are sharpening this neural connection significantly. This creates a stiffer, more responsive ankle joint that can react in milliseconds if you step on an uneven sidewalk or a slippery rug. This level of reactive strength is a clinical necessity that endurance walking simply does not provide because the mechanical stimulus of a rhythmic walk is too weak to trigger the protein synthesis required to maintain these protective fast-twitch fibers. As your calves grow stronger, you will notice that your walking gait becomes more springy and less heavy, providing a sense of groundedness that is essential for navigating the world with complete confidence. This is not just about muscle size. It is about building a responsive foundation that keeps your entire body stable regardless of the terrain you encounter in your daily life. The final pillar of our clinical routine targets the hip flexors and the iliopsoas muscle group, which are the primary movers responsible for the swing phase of your walking gait. One of the most common and dangerous signs of physical decline I observe in my older patients is the shuffling gait. This happens when the hip flexors become too weak to lift the foot high enough to clear the floor, causing the individual to slide their feet rather than lifting them. This is a primary cause of trips over invisible obstacles like door thresholds, carpet edges, or small cracks in the pavement. Walking does very little to strengthen these muscles because the range of motion in a normal stride is shallow and efficient, requiring almost no effort from the deep hip muscles. To counteract this, the third clinical movement I prescribe to my patients is the marching knee lift. This movement isolates the hip flexors and retrains the nervous system to lift the leg through its full range of motion. While holding onto a stable surface for safety, you must lift one knee toward hip height, or as high as your current mobility allows, then lower it slowly to the ground before switching legs. This slow, controlled tempo is critical because it forces the deep pelvic muscles and the lower abdominals to stabilize your spine and pelvis. This exercise effectively clears the path for every step you take by retraining your brain to lift your feet clear of any potential obstacles. I recommend 10 to 15 repetitions per side for 2 sets. It is vital to understand that your body remains remarkably plastic and capable of adaptation even in the 7th, 8th, and 9th decades of life. Medical research has proven time and again that targeted resistance training can increase muscle density and improve bone mineral content regardless of age. While walking is your maintenance for the cardiovascular system, these 3 exercises, the sit-to-stand, the heel raise, and the knee lift, are the structural armor that keeps you independent and safe from the physical trauma of a fall. Health is the ability to move, but safety is the ability to stay upright under pressure. You need both to age with dignity and confidence. I advise my patients to perform this routine 3 to 4 times a week. focusing on the quality and control of each movement rather than speed. Within a few months, you will likely find that the fear of falling begins to dissipate, replaced by the clinical reality of a body that is strong, stable, and ready for the years ahead. Your independence is your most valuable asset, and it is built on the foundation of your leg strength. By integrating these simple, physician-approved movements into your life, you are taking a proactive step toward a future where you remain mobile and in control of your own journey.